Good afternoon. Today we'll be rationalizing your renal nursing, part of your module 1. Number 1. Client has an AV fistula in place in the right upper extremity for hemodialysis treatments. When planning care for this client, which of the following measures should the nurse implement to promote safety? So, our issue here is to promote safety. And going back, history of your client, patient has AV fistula in the right upper extremity. Okay, so that's the history of your client. Going. Letter A, take BP only in the right arm. So we all know that taking BP on the fistula side is contraindicated. So eliminate A. B, use the fistula for all venipuncture. Again, we do not use the arm where the fistula is located for venipuncture and IV insertion and BP taking. We do not use that. So A and B are contraindicated. So that leaves us only two options, C or D. Ensure that small clamps are attached to the AV fistula dressing. D. Assess the fistula for presence of bruit and thrill every 4 hours. Okay, so the answer here will be thus. Remember that when your patient have AV fistula, you always assess for bruit and thrill. Bruit is auscultated, while your thrill, this is palpated. So always assess for that. It tells you about the integrity of the fistula. Okay, so the answer is D. Letter C is done for if the shunting is done externally, but this is internal, so there's no need for dressing to be attached here or clamp. The answer here is letter D. Next, number 2. Home care nurse is making follow-up visit to client after renal transplant. Nurse assess the client for which sign of acute graft rejection. So we're looking for manifestation of acute graft rejection. Now, when you say acute graft rejection, it means the WBC is attacking the graft. And when the WBC attacks a graft, there will be an inflammation. There will be an inflammation. Okay? And when there's inflammation, we all know that all of your vital signs are tendencies or your vital signs are elevated because this is graft rejection. So the inflammation may be more systemic than local. So let's find options that have increased inflammation. So let's eliminate A because of hypotension. Let's eliminate B because of hypothermia. It should be hyperthermia. So that leaves us only C or D. C, fever, hypertension, graft tenderness, and malaise. Or D, fever, vomiting, hypotension is wrong. The answer here is letter C. That is graft rejection. Next, number 3. A nurse is developing care plan for a client with urge incontinence. Which of the following intervention will be most helpful for this type of incontinence? So we're looking for interventions most helpful to what? To a client. What's the history? Client who has urge incontinence. From the word incontinence, this is involuntary. Involuntary passage of urine. Voluntary passage of urine. Urge. After feeling the urge to urinate. Voluntary passage of urine after a strong after a strong urge to urinate. This is urge incontinence. Okay? Possible cause would be secondary to bladder spasm, bladder spasm. What else? Alcohol or caffeinated drinks, caffeine. Um, what else? Decrease bladder capacity. What else? Infection, and so on and so forth. So going back here, look at number 6. Intermittent catheterization is not and never will be. This is never an intervention for incontinence. And patient will be high risk for UTI. So we do not do 6. So let's eliminate A. And the answer here is Boston or letter C, because they have same. So 2, 3, 4, 5. These are beneficial for urge incontinence. Surgery is not. This is not helpful. Okay. Answer here is B or C. Next. Number 4. Client is scheduled for computed tomography, CT scan of the kidney to rule out renal disease. As an essential pre-procedure components of nursing assessment, nurse plan to ask about which history of. So issue here is, what do you need to assess? Assess from what? From a client scheduled for CT scan. And for CT scan, or which important pre-procedure assessment for client undergoing CT scan? CT scan usually may or may not involve dye. So option that has something to do with dye is letter A, allergy. Okay, because dye, clients who have allergy to seafoods tend to be allergic to the dye too, because both of them are iodine based. Next. Number 5, nurse assists a client who has renal disorder collect a 24-hour urine specimen. Which does the nurse implement to ensure proper collection of 24-hour specimen? So issue proper collection of what? 24-hour urine. That's the issue here. We're looking for proper. A, is this proper? Maybe. B, is this proper? No, because straining, this is not done for 24-hour urine correction. Save all urine beginning with the urine voided? No. You ask the client to void before before starting 24-hour urine collection. Ask the client to void, discard. From that point in time up to the end, that's the only um, urine specimen that you will be considering. And Dallas is wrong because you need to send this to the lab immediately. You need to send this to the lab immediately. The answer here is letter A. Next. Number 6. Nurse plan care for a client diagnosed with ESRD or your end-stage renal disease. Which finding does the nurse expect to find in the client medical record? Select all that apply. So when we say ESRD, this is the last form of chronic kidney failure. And when you say failure, it means the kidney is not able to perform its function. And there are two main functions of the kidney. That is for the water balance and for RBC production. So going back here, of course, anemia expected because like I said, kidney is the one that stimulates RBC production. That's number two. So let's eliminate A and C. B or D is the only option we'll have. The answer here is look at D, 2 anemia, 1 edema, B, 2 anemia, 3 polyuria. No, it should be oliguria. The answer here is Dallas. Next, number 7. Client has been admitted to the hospital with diagnosis of acute glomerulonephritis. During history taking, nurse should first ask the client about which history of. So we all know that AGN is a complication of group A beta hemolytic streptococcus infection. The answer here is Dallas. Next. Next, number 8. Nurse is assigned to care for a client with nephrotic syndrome. Nurse assess which important parameter on a daily basis. When you say nephrotic syndrome, it's a condition wherein there is proteinuria. You're urinating urine. If you urinate urine, the level if you proteinuria is the urination of protein. If you urinate protein, the patient will have decreased albumin in the body, hypoalbuminemia. And if you decrease albumin in the body, there will be fluid shifting. Therefore, you need to monitor A, weight, because this is the most accurate parameter for fluid status. Next, number 9. Clients be admitted to the hospital with diagnosis of urolithiasis and urethral colic. Colic means pain. Pain arises from the ureter, which means the stone is in the ureter. Nurse assesses the client for pain that is, answer, drums, excruciating wave-like, radiating to the genitalia. This indicates that the stone is in the ureter. Next, number 10. Client with renal failure is receiving epoetin alpha to support erythropoiesis. Nurse questioned the client about compliance with taking which of the following medication that supports red blood cell production. So there's only one here that supports RBC production, that is letter A, iron. This is necessary for hemoglobin production. Next, number 11. Nurse insert an indwelling Foley catheter into the bladder of a post-op client who has not voided for 8 hours and has distended bladder. After the tubing is secured and the collection bag is hung on the bed frame, nurse noticed that 900 ml of urine has drained into the collection bag. The appropriate nursing action for the safety of the client is, so issue here is safety. Answer here is Boston. Why? Because rapid emptying. Rapid emptying of the bladder can cause vasodilation, of pelvic blood vessels. It can lead into shock. So therefore, you need to clamp. B is the answer. Next, number 12. Client with a posterior wall bladder injury has a surgical repair and placement of a suprapubic catheter. Nurse plan to do which of the following to prevent complication with the use of this catheter. So remember that the patient have suprapubic catheter in place into the bladder. Okay, so the answer here is Dallas. Why? This is to prevent build up of urine. Prevent build up of urine. Because this buildup of urine has the possibility to put tension to the suture. So decrease tension to the suture. So remember that there is a catheter in place and there is suture around it so that the catheter cannot be removed. So prevent tension in the suture, you must prevent buildup of urine. Next, number 13. Nurses care for a client scheduled to undergo a renal biopsy. To minimize the risk of post-procedure complication, nurse report which of the following laboratory results to the physician before the procedure. A. Potassium? No, because this is normal. B. Serum creatinine? Is also no, because this is normal. Normal serum creatinine is 0.6 to 1.3. So this is normal. BUN? No, because that is normal. Normal BUN is 5 to 20. Answer C. Why? Because normal PT, prothrombin time, should be between 11 to 12.5 seconds. C is the answer. Next, number 14. Client with acute pyelonephritis has nausea and vomiting and is scheduled for an IV intravenous pyelogram. Let's place highest priority on which of the following. Is it A. Ask a client to inform consent, explain procedure, place client on early intake, or request a prescription? Answer, Talas. Why? Because pyelogram will use dye. And dye, when you're going to use dye, it is important that you have normal hydration. And the patient had history of vomiting. So there's a history of fluid loss. So you need to replace that fluid loss before the start of the procedure. That's why you give IV first. Dallas is the answer. Next. Number 15. Client with urolithiasis or your kidney stone is being evaluated to determine the type of stone that is being formed. Nurse plans to keep which of the following item available in the client's room to assist in this process. We all know the answer. The answer is letter A. If your patient have kidney stone, the client is asked to strain, and whatever is strained will be sent to the lab, and the lab will test what type of stone is formed, because the type of stone will determine the type of management. Next, number 16. Nurse is preparing to care for a client after ureterolithotomy, opening of ureter, who has a ureteral catheter in place. Nurse plan to implement which action in the management of this catheter when the client arrives from the recovery room. So the client comes from recovery room, which means there is no more anesthesia left. That's why he was being transferred to the original room. So the answer here is you must letter C. Check drainage from the catheter. So the catheter was placed to so that the urine will pass through that catheter for the meantime. Therefore, you need to evaluate the function of the catheter. C is the answer. Next, verse 17. Nurses a prescription to ambulate the client with nephrostomy tube in the hall 4 times a day. Nurse determined that the safest way to accomplish this while maintaining the integrity of the nephrostomy tube is answer letter A. Because letter A, um, it is the best way for to promote ambulation and to maintain integrity of the nephrostomy tube. So the collection bag will be connected or to a bag that is attached to the leg so that the client can walk without destroying the integrity of the nephrostomy tube. So the best way is letter A. Next, number 18. Client newly diagnosed with polycystic kidney disease has just finished speaking with the physician about the disorder. Client asks a nurse to explain again what the most serious complication of the disorder might be. In formulating a response, nurse incorporate the understanding that the most serious complication is. So what is being asked in number 18 is the most serious complication of polycystic kidney disease. And the answer here is letter B. End-stage renal disease is the most serious complication. Most serious complication. Number 9. Next, number 19. A nurse is developing a plan of care for a client who has returned to the nursing unit after left nephrectomy. Nurse should include which assessment in the plan of care? Select all that apply. Pain level? Yes. Vital signs? Yes. Early output? Urine? Yes. Tolerance for sips of clear liquid? No, that's not necessary. Ability to cough? Yes. Answer? Letter A. 1, 2, 3, 5. Next. Number 20. The nurse developed a care plan for a client receiving hemodialysis who has an arteriovenous fistula in the right arm. The nurse include which intervention in the plan to ensure protecting the AV fistula? Select all that apply. So the issue here is you want to protect the AV fistula. 1. Assess pulse and circulation proximal to the fistula. Of course, this is wrong. It should be distal, not proximal. 2. Palpate for thrills. That is correct. Check for bleeding and infection. That is correct. 5. Number 4. Avoid taking blood pressure. That is also correct. 5. Instruct the client not to carry heavy object. That is correct. And number 6. Instruct the client not to sleep in a position that places his or body weight on top of the extremity. That is also correct. So it's 2, 3, 4, 5, and 6. The answer here is letter A. Next, number 21. Client with calcium oxalate renal calculi is told to limit dietary intake of oxalate. Nurse provides the client with a list of foods high in oxalate and place which item on the list. Select all that apply. So the patient has a renal stone and the stone is made up of calcium oxalate. Therefore, the patient needs to have food low in oxalate. Therefore, for the patient to be able to avoid this, patient should identify food that is high in oxalate so that she can remove them from her diet. So, please take note that fruits are generally low in oxalates. Fruits generally are low in oxalates. Therefore, the answer here is 1, 2, 3, 4. All of these are high in oxalates and that should be Boston. Next, number 22. Nurses admitting this nursing unit client who has an AV fistula in the right arm for hemodialysis. Nurse plan to best prevent injury to the site by implementing which of the following? Issue here is best preventing injury to the AV fistula. A. Apply an allergy bracelet to the right arm. This is not necessary. B. Putting a large note about the access site on the front of the medical record. This is not necessary. C. Telling the client to inform all caregivers who enter the room about the presence of. This is not the function of the client. This is the job of the nurse. Therefore, the answer here is Dallas. Place a sign bed at the bedside says no BP measurement or venipuncture to the right arm because this is contraindicated. Next, 23. Client with urolithiasis is scheduled for extracorporeal shockwave lithotripsy. Nurse ensure that the client understands the procedure and tells the client that A. There is no discomfort. This is wrong because there is some discomfort. B. There are no side effect or complication. Again, this is wrong because one of the complication of your extracorporeal shockwave lithotripsy is hematoma. C. Stone granules are passed in the urine within few days. Or D. Procedure involves breaking up the stone by a vibrating needle that is inserted into the urinary tract. This is wrong because this procedure is non-invasive. Non-invasive. Therefore, the best answer here is letter C. This is true and accurate about this procedure. Next, number 24. Client with chronic renal failure has an indwelling peritoneal catheter in the abdomen for peritoneal dialysis. While bathing, the client spills water on the abdominal dressing covering the abdomen. The nurse plans to immediately. So the issue here is what must the nurse do first? Immediately. When the dressing that covers the abdomen where there is a peritoneal dialysis is wet with water. Answer, letter A. Why? Because in peritoneal dialysis, one of the issue here is client in peritoneal dialysis is at risk for infection. Patient is at risk for infection. So if the dressing is wet, we all know that wet or moist area promotes growth of microorganisms. So it increases further the risk for infection. A is the answer. Next, number 25. Nurse has given the client with a nephrostomy tube instruction to follow after hospital discharge to prevent complications. Nurse determined that the client understand the instruction if the client verbalized the need to drink at least how many glasses of water per day. So a client who has a nephrostomy tube needs a normal, adequate fluid intake, which is Boston, 6 to 8 glasses per day. B is the answer. Next, number 26. A client with nephrolithiasis arrived at the clinic for a follow-up visit. The lab analysis of the stone that the client passed a week ago indicates that the stone is composed of calcium oxalate. On the basis of this analysis, the nurse tells the client that it is best to avoid which of the following food to minimize the risk of occurrence. So we're looking for a food that is low in oxalate. I mean, avoid, so we're looking for the food that is high in oxalate. Pasta, let's eliminate. Usually vegetables are high in oxalate. So that's between B, C, or D. And among these three, the highest in oxalate is Dallas. Spinach is high in oxalate. D is the answer. Next, number 27. A client has a history of urolithiasis related to hyperuricemia. So the client has kidney stone and due to hyperuricemia. So we can say that this stone is made up of uric acid. To prevent the formation of future stones, nurse instruct the client to avoid certain food, including, so we're looking for food that is high in uric acid. And we all know that organ meats are high in uric acid, which is letter A. This is an organ meat. It is high in uric acid. Next, number 28. A female client is being discharged from the hospital to home with an indwelling urinary catheter. After the surgical repair of the bladder after trauma, nurse determined that the client understand the principle of catheter management to prevent complication if the client stage 2. So we're looking for a sign of understanding about what? How to prevent complication. So is it A, cleanse the perineal area with soap once a day? No. Eliminate A. It should be twice a day. B, keep the drainage bag lower than the level of the bladder? Yes, because we all know that the drainage, the principle in drainage is gravity. So the bag should always be lower than um, the tip of the catheter so that the flow of the urine is pababa. Letter C, limit. Of course, no. Do not limit. Instead, encourage. Next. D, coil. Of course not. That's always wrong. The answer here is Boston. Next. Number 29. Client with prostatitis as a nurse. Why do I need to take a stool softener? Problem is with my urine, not my bowels. Nurse make which response to the client? So, client has prostatitis, and we all know that prostatitis will experience pain on defecation. Therefore, the harder the stool, the greater the pain. So it is important that the client should be able to defecate easily. And how would that be possible? The answer here is we give stool softeners. Therefore, the reason here why we give stool softener is Dallas. Help prevent constipation because straining will cause pain. Next, number 30. Client is being discharged to home after prostatectomy. Nurse plan to teach the client which of the following points is part of the discharge teaching. A. Mowing the lawn is allowed after 1 week. No, because after the surgery, you need to avoid strenuous activity. B. Eliminate, because you need to avoid lifting for at least 20 pounds, not 50. Drink at least 15. This is excessive. Excessive. Eliminate C. Dallas is the best answer because this is sign of infection. This is the answer. Okay. This is the end of your renal nursing. Thank you.